Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to personally welcome you to episode 77 of the Ask Dr. Angela podcast. So check this out. It was all a dream. I used to read Word Up magazine. That's the opening line to my About Me section in my new pregnancy book. Who does that? This woman over here does that. I love Biggie Smalls. And that just was a great feel-good song. And I decided to quote that in my book because I like it a lot. And it's just who I am. There's a big plug for my book right there, right? I'm so excited about this book. It is literally going to be thebomb.com. And I'm really hoping that it will breathe a breath of fresh air into pregnancy, all that it's about, and helping moms all over the world to embrace it, and frankly, just to know what the hell's going on. But anyway, we're going to jump right into today's topic, which is bone density scans and when to get them. I have to tell you, on a daily basis, I see patients that are in their 40s, 50s, that have already gotten a DEXA scan or bone density scan. And I'm like, so why did your doctor order this? And they're like, I don't know. So here's a teaching point right here, people. Whenever your doctor is ordering tests for you, ask why. Because I got to tell you, and most of these women that I see that are getting these early bone scans, it's completely unwarranted. So first of all, let's start by talking about when you should be getting a bone density scan. That screening starts at 65 years of age. And the only time that it is recommended that you get a DEXA scan or a bone density scan prior to the age of 65 are going to be for a couple of reasons. Number one, if you have a medical history of bone fractures, breaks, etc., if you are a really petite woman, and I think that they're using a body weight of less than 127 to define petite. If you have obvious medical reasons, whether it's chronic medical conditions or if you're on chronic medications like steroids that have a known association with causing bone weakness, that's another reason. If you have a family history, i.e. a mom or a dad that has a history of a hip fracture, if you are a current smoker, if you have a history of alcoholism, or if you have rheumatoid arthritis. There it is. I just ran down the list of things that you would have to have going on in order for me to order a bone density scan on you prior to age 65. And this is as pertains to postmenopausal women. Okay, so if you're postmenopausal and you're younger than 65, those reasons that I just listed are really the only reasons that you should be getting an early bone density scan. Okay. The other thing that I guess we should probably talk about is how often you should be getting these scans. Now, in people that have bone loss or osteoporosis, the recommendation is not any sooner than 2 years. Okay, so Q2 years, because we need an opportunity to see if the recommended treatment, which is usually going to be lifestyle modifications, some kind of bisphosphonate, what's the common bisphosphonate that we commonly use for bone osteoporosis? Boniva. Yeah, that's a big one. Reclass is another one. So if you're being treated with medications such as this, we also put you on calcium and vitamin D. It needs some time. We need some time to see if these measures are actually helping. So typically the recommendation is not to repeat a bone density scan sooner than every 2 years. However, if you have a normal bone density scan, you really can go for years. I usually wait for at least 5 years before I'm repeating DEXA scans in people that have normal scans. So I hope that this has helped someone with regards to bone density scan screening, osteoporosis screening, when you should be getting these tests done, etc. Because I see far too many people that aren't even eligible for these tests that are coming in with these bone scans. And I'm like, why did we get that? Why did your doctor get that? So no, ask questions. As my friend G.I. Joe says, knowing is half the battle. I'm hoping that this podcast has helped somebody out today. Thank you so much for tuning in. We are having just a good time over here at the Ask Dr. Angela podcast. Really love my team. That's a shout out to you, and Mike Koala, the self-employed king. We're just doing the damn thing, and I'm just excited to have an opportunity to work with you guys. And for you all, my followers, we are really doing the damn thing. I love all of your support, and just thank you from the bottom of my heart. Thank you so much for tuning into this episode of the Ask Dr. Angela podcast. If you have a question or a topic that you would like featured on the podcast, please go to www.askdrangela.com. That's AskDrangela.com. Click on the microphone on the right-hand side of the page and do what you do. For those of you that have submitted questions, please be patient. We will get to them. It's just that we have so many people that are submitting questions and topics. It's a bit overwhelming, but in the best way. So be patient. And again, remember, if we use your question, somebody from the team will reach out to you so that we can send you one of our bomb-ass t-shirts. In closing, I'd like to leave you with this. When things don't happen right away, just remember, it takes 6 months to build a Rolls Royce and 13 hours to build a Toyota. So in business, excellence does not happen overnight. It takes time. So don't quit, be persistent, determined, and stay on your grind. Until next time, look better, feel better, be better. I cannot wait to reconnect with you on episode 78 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.